I'm looking for someone to join my practice. You are qualified for the position. I just need to ask you a few questions before we proceed further. What are your strongest verbal and non-verbal interpersonal skills that help you with your patient-practitioner communication?
So my strengths and verbal skills lie mostly in listening. I'm a very good listener as I can keep myself in the present and focused intently on the person who's talking. I absorb the things being said and I'm able to develop appropriate questions to ask the patient based predominantly on their non-verbal cues in response to what I've said. I'm also really aware of my body language and can help people feel more at ease through things like smiling or leaning towards them a little and maintaining open posture to show my interest in what they're saying. I also always maintain gentle eye contact where appropriate.
Good. Can you explain your understanding of the therapeutic relationship?
So the therapeutic relationship is obviously very important. It's the professional relationship between the practitioner and the client, understanding and catering as much as possible to the specific client's needs to ensure they get the most out of their sessions. Also making sure communication is open and comfortable between both parties so that myself as the practitioner can do the best job I can for my client.
Okay. How have you demonstrated self-awareness in a therapeutic setting?
So when I communicate with clients, I am aware that I can be very facially expressive, and I'm also aware of how certain expressions may come across to the patient. So I'm constantly checking myself to make sure I'm neutral or appropriately expressive for the situation.
Okay. Tell me about your personal values and motivations and how they would help you as a practitioner.
So I've always been really passionate about helping people in general in whatever capacity they need. So I'd be very open-minded and flexible when it comes to finding the right treatment plan for individual clients. I'm also very compassionate and empathetic. These are two values which I feel would really help me to be effective as a practitioner, as I'll be able to connect with my patients emotionally.
Okay.
Sorry.
Give me your top 3 strengths, talents, or qualities that help you as a practitioner.
I think my top 3 would be being empathetic, a good listener, and I'm really good at maintaining calm in difficult situations.
Okay. Tell me about your areas you see room for potential growth and development.
I'd really love to grow as a practitioner by developing strong working relationships with colleagues here. And I think gaining knowledge from them based on their experiences, study, or previous cases would be really helpful. I would probably love to work for my own practice someday, so for myself.
Okay, great. Give me an example of how you would demonstrate self-care in a therapeutic setting.
Okay, this is an important one for me because I do tend to take on the emotions of those around me very easily. So, obviously, having self care strategies in place are important. I practice self care every day through meditation first thing in the morning and then between each client. Even if it's only for a short amount of time, I find it really helps. I also care for myself by making sure I get enough fresh air and that I'm around nature or plants where I can be, so whether that be having an indoor plant or sitting outside for a few minutes. I'm also quite good at knowing my limitations, so if I feel that a particular case is a bit too much for me, then I will refer to a colleague.
What mindfulness skills would you bring into this practice? Can you give me an example?
So before I begin sessions with clients, I have a few things that I do. So I always make sure to allow myself 10 minutes between each client so that I can meditate and recenter myself and focus fully on the next client. I also tend to use a notepad or journal throughout the day to record any personal thoughts, feelings, tasks that randomly pop into my head so I know that they're written down. And that way I can come back to them after I've finished seeing patients for the day.